The first article I'm examining is a study that was undertaken by a team of researchers who have identified the problem that although in Tasmania they offer free early childhood health and education services, that are not being engaged, that vulnerable families are not being engaged greatly with those services. So the objectives of this research is to find out how those outreach practices function and then to try and help those families to build those important connections to increase participation. Do the information that was required, which is very relational, the team went for a ethnographic research method, which is very well suited to this social processes and using those lived experiences in the context of the chosen participants. So it focuses on relationships and how they're built and how they're maintained, and why some approaches work and some don't. So it's the methodology used by the two researchers was undertaken over a period of 11 months, and they had a variety of data collection techniques, including unstructured observations in those different settings, and they semi-structured interviews to hear personal experiences and perspectives. They recorded informal conversations and took field notes with educators, staff, centre staff, parents, nurses. They recorded informal conversations, and they recorded everything they saw and felt, and also included non-verbal behaviours and their own reflections. They analysed the policy documents and plans and procedures to understand how the outreach was formally supported and then compared to what actually happened. They collected brochures and posters, so it's a quite well-rounded approach of collecting data. I think the downfall of this collection was that the two researchers weren't living in the communities, which might have made them miss important events and getting that crucial connection and the trust of some of the participants. The sampling methods were purposeful, so they had a selection of criteria. They chose the settings, and which was this highly disadvantaged socioeconomic settings, which is in ranking 1 out of 10 in the IRSD. They knew that the engagement with the services was low because of some of the data from governments. That's why they chose those areas, and it was rural and suburban locations, but no cities. The parents were also a variety of people with more experience, single parents, partnered, and different children with different ages. So this was is beneficial, the purposeful sampling. So they actually because their goal was to not to generalize the findings, but to deeply understand it in that context, in that community. So the problem is now they need to be aware that this can't be generalized and it can't be transferred, not even within other areas in Tasmania or North Australia. So very context specific. And another issue I think was that they very most vulnerable ones, which have distrust to the services, and they were very isolated, were not included. So it was quite a small sample of 32 parents and 42 service providers. So the full diversity of families has not been recorded there. To analyze it, they used a open coding technique, which means they break down all the data collected and into small pieces and label them with codes to find trends. And then they were all entered into a software to handle that large volume and centralize all the data. And there were multiple researchers, not just the two, who helped analyze the data, and they constantly compared the meanings and including the thoughts and the reflections of the researchers to try and eliminate as much bias as possible. It would have been quite interesting to see how the power dynamics between families and services worked, and how the lack of policies and the awareness of what outreach actually is. That could have been interesting to see. I think that's a little bit missing, and understanding those issues would have been probably shown the underlying issues of maybe mistrust or the rigid structures of those institutions. And it could have helped build some frameworks if they were going into a little bit more of the why and not just the how, if that makes sense. The reporting of the data was in headings and quotes and with some narratives. The quotes gave authenticity and make the reader feel very connected, so I like that part. It was very positive, so I think there was some negative example missing and some contradictory viewpoints. It would have shown a bit of a more rounded situation, I think. And it was quite text heavy, so I would have liked to see some visual tools to help support understanding, and that might have helped also to engage a wider audience of readers. They could have made a timeline, how the families engage across the duration of the months, a diagram showing the relationships maybe between the service policies and the staff and the family engagement. That would have been very interesting too. Overall, I have to say that this type of research, the ethnographic research method, is probably my favorite one. I didn't know much about research as such, so starting to understand a little bit more makes it more enjoyable, because I thought these research studies were always quite dry and boring to read, but now understanding a little bit more the reasons behind it and some of the flaws and shortcomings of those research studies makes it a little bit more interesting and makes me feel more capable and worthy of reading them, if that makes and this ethnograph is probably one of my favorite types, and I can see myself engaging in that in the future, because it really aligns with my values as a kindergarten teacher, where our main assessment is behavior study and observation, and making sense of it for my future practice and reflecting on those behaviors and how I react to it and how other children react to it. So that is that.